What we can expect with a stem cell therapy? Good afternoon. Here today in BIOS we have Dr. Anna, who is going to explain a little bit more about our stem cell therapy. She is the medical director in BIOS, and she is a hematologist, pediatrician, and she knows a lot about these therapies, and she wants to share with us more information for you and for all the people who is connected. Thanks for being here, and also to please during this webinar ask all your questions. We will try to answer all of them. So first I want to explain a little bit more about what we do here, what is a stem cell therapy. So welcome, Dr. Anna, how are you?
Hi, Dr. G. We are very pleased that you are joining us today. And Dr. G and myself, we are the doctors that you are going to know when you decide to come with us to BIOS. We are very happy that you join us, and like Dr. G has already said, we hope that we can answer all of your questions and that you don't have any doubt about stem cell therapy.
First, we have to share a little bit more about the background of the stem cell therapy. And in this, what is a stem cell transplantation and what is the effective and the safety of these kind of therapies? First, when we are talking about autologous stem cell therapy, what we are doing here in BIOS, we talk about something really safe because it's their own patients' stem cells. But this has the quality to repair and to help the patients in the neural area and in their neural system to make a difference in them and make a change in their quality of life. So this is what we are going to talk. I think this is not something new. This already has more than 20 years, so I don't know.
Yeah.
Well, also we have to tell that here in BIOS we have been working with stem cells for more than 13 years. So this is the time we have been investigating and also making this kind of therapies. I think this is important, and maybe you want to explain a bit more about what is the origin of the stem cells and the difference between a stem cells that is from other person or from their own patient.
Right, thank you. First of all, like Dr. G has already said, here in BIOS we made stem cells in a procedure that is autologous, so it's safer, and it allowed us to have more control in the quantity of the stem cells that we're going to infuse, and also because we can replicate this therapy several months later in our patients. When you Google stem cells, you can find a lot of information and different sources of stem cells, and we can have embryonic stem cells that they are only produced in the fetus, pre-birth, and we have the adult stem cells, that is what we normally use, and it's very important that you choose the specific and the right ones for your patients. When we have an autologous procedures, like I already said, we can replicate the procedure, and also there is also the importance that the regenerative function that the stem cells do in the body helps in and improve the benefits that in the nervous systems, in the nervous system, central system of all of our patients.
I think it's important to say that the stem cells that we use here in BIOS are from the bone marrow.
Yes.
Difference in other centers, they use stem cells from fat of the patient. So for this kind of stem cells therapy, they have to do a liposuction that is a really invasive procedure, and not all of the patients are candidates for this kind of therapy. The therapy that we do is really simple, is not so invasive, and is really like something the patient can release in this day and doesn't have any trouble. I don't know if you want to explain a little bit more about this and the benefits of the stem cell therapy.
Of course. Also, there is another. I skipped something. There's another source of stem cells that are the cord blood cells. But it is important to note that not all of the patients, and not all of have the opportunity to keep the umbilical cord in a blood cord bank, so we are not able to use it for these kind of therapies. And that is one of the main reasons that we decide to do an autologous procedure, because it doesn't matter if we don't have the cord blood of our son or our daughter. The autologous treatment also, like Dr. Guillermo says, is important that it's in our case is ambulatory. So the patient is not necessary have to be in a hospital room. It's we try to make a nicer environment in the patient, so there is not more stress in the patient, and of course in all of the family, and we try to make you the more friendly possible as we can. Important in the autologous also is that because it's our own genetic and we are not mixing genetics from a different patient or from a different or a lot of donors in the case of when they are from fat or from mesenchymal cells. The difference with us is that there is no the risk of a dangerous tumor growth or a graft versus host in the patient basically is not it doesn't exist. So that is also very important, and that's what the main reasons that we decide to do an autologous procedure. And also, like I already said, we can repeat the procedure in case that the patients notice benefits, so we can do it several months later, and that is something very important because the things that our patients gain during the therapy, they can
increases, and this kind of benefits stays in there, and it's something that the patient like goes getting better and then stays there, so it's something really beneficial and doesn't goes back. We didn't have any patient that says after therapy they have a regression in their benefits, so that is something also important. But also I think it's important to talk about this infection of graft versus host disease. That is something that you can see in other patients when you have a donor that gives you the cells and it's not your own stem cells. You can have this kind of disease. In these kind of cases that we use autologous stem cells, you don't have this possibility because you are your own donor.
Exactly. So in our procedure, we ask you to be here in our city around 1 week. Because it is important to note that we don't have stem cells in the circulations. We have to produce them. We have to increase the number with a medicine that we provide here in Valle. So the first 3 days of the week that you are here, we're going to stimulate the production of the stem cells. On the first day also we make a lot of kind of exams of lab tests, exactly. So we are totally sure that everything is okay with our patients, that it doesn't have an active infection, that is not anemic, that their platelets are in a good number. And then we start the stimulations for 3 days. The 4th day is the big one, is the day of the therapy. And what we do is that we go to an operation room, and under sedation, a mild sedation, the patient is going to have first the bone marrow aspiration, like in the picture that we are presenting to you, where there is a special needle that we introduce in the bone marrow of the patient, and we take what is the bone marrow. That depends on the age of the patient and how much the patient's weight. Though the bone marrow that we recollect, we have to we take it to our lab, and our lab technicians, they are very, very good in separating and processing the stem cells. And then when we have all of the stem cells in in like a
concentration
of stem cells, we make the infusion in the patient, and the infusion of the stem cells, we do it intrathecally. That is the most important source because it's going to be directly in the central nervous system of the patient, and also a IV in the IV route. So this can also work in a different parts of the body. And that's why we said it's about 1 week that you have to go, have to be with us. There is something very important that we try to be connected with the patient every day, and we make a follow-up several days later to see that everything is okay. And you can always can be in contact with us. You have our phone numbers, you can text us or anything, so you can be totally sure that everything is okay. And if you have a doubt, we try to resolve it in that moment.
In this next slide, you will see some of the pictures about the procedure. As Dr. Ana told you, first we are going to make the lab test to know that the patient is healthy and doesn't have any problem. Also, our health department asked us to make a donor profile. The donor profile study is something they request because you are going to make your own donor in this, so they want to know that you don't have any kind of infection, particularly viral infections. So we do this test, and this is the first thing we do. Also, we start with the shots of the stimulation. It's 3 shots, 1 per day. And then the day number 4, as you see in these pictures, is the extraction and the infusion of the stem cells. So this is, and you can also see in one of these pictures that the lab, the lab staff, they will be helping us in the separation of the stem cells. They are doing this procedure in a special cabin that is really sterilized, and is everything really good, and they doesn't have any trouble inside of them, because everything is in these flow cabins. You cannot enter viruses or fungus or any kind of infection in there. So that is why we take care in all these steps to be sure that the process is good and we are not harm the patient.
Before this, I want to say that it's important that you totally be sure about the quality and that you are really getting stem cells. It is important to know that you are not going to get stem cells with a simple IV without stimulations. And also, we in all of the lab tests that we do in our patients, our CD34, that is the stem cells, we take it to an external lab, so we don't have any interest conflicts, and that you are totally sure that the CD34 are real, and that we have a way to prove that. Because sometimes we have patients that they are not totally sure that if stem cell therapy were done or no, and it is important for us that you are totally sure, and we can prove that with this test that, like I said, is not from our lab, so you can be totally sure about that.
Also, it's important to know that what we are offering here is not a cure. It's a therapy that helps to increase the quality of life of the patients. And this is something really important, because in other places we have heard that they say the patient is going to be completely cured and it's going to be completely different and you will have a new kid completely. No, we want to help them to be better in all the ways possible, and we are going to talk a little bit more in particular in the patients with cerebral palsy and the benefits that they could have with this stem cell therapy. But I know some people is connected this moment with us that has autism patients, so at the end, if you have any questions, we will be glad to answer all of them. Okay. So please continue with the next. About the expectation of the therapy. So I think the first thing is the patient will have a better motor control. That is something really important. The cognitive area is going to improve a little bit. They could be more, they will have more attention, they will be more understanding what is happening. Some of them they expect, some of them they start to make better communication. We have some patients that already told us the patient starts with making noises and then start with some vowels and then some words. So this is some of the benefits that we could have with the therapy. Also, the spasticity of the patient will decrease, and this is something really something that we will see really common. And I think the gross motor coordination will be really good, you know, and also the fine motor skills, but the gross motor will be something that is already in a lot of publications and a lot of in the medical area. We already have seen this is really working in them.
This in the screen there's a few pictures of our patients that have come with us these years, and we have patients that actually improve a lot, specifically in cerebral palsy. Like Dr. G has already said, the motor growth is very important. So we have patients that are now able to walk with help, or to can be more independent about to act like to transportation. Sorry. And also about what doctor said about the swallowing is important, because with this improvement about about eating, the patient is going to have a better weight, and with this better weight it's going to have more muscle, so everything is going to change. So it's something that we are really proud that all of the improvements that our patient has during several months after the therapies.
Also, some of the patients has been tell us that the bladder or the bowel control is better. Some of them start to skip the using the No, for bowel control. So they start to use the toilet, the diaper. Yeah, they stop to use the diaper and start to go to the toilet normally. So this is something that we can also see in our patients. Some of these improvements. In particular, if we see a patient with this, some of them starts to be more easy to walk. There starts to be more easy to do the therapies. It's easy to communicate with them. And something that we want to share is this slide. That is the crucial goal of this kind of therapy is to substitute the injury areas or the injury tissue with new tissues. The way we do it is with the stem cells. So this has been also published in the different medical journals, and that is something that we want to share to you and to let you know that is something already studied. Yeah.
Next one. So this is our city, and this is our clinic.
Our facilities.
Facilities, and we have been here around 13 years. Our staff, I think that most of us are here since the beginning, and we try that you are very comfortable in your stay here in the city. We have a very good lab staff, because sometimes it doesn't matter if we have everything, but if you don't have the quality to do the things, it's not going to be a good ending. So everyone is really prepared. We try to make courses in a continuous way, and we try to, like I already said, that you are really comfortable during your stay here with us. We have had patients these several years from different places, not only Mexicans, from US, from Canada, from Australia, I don't remember where.
From Europe, Spain. We have several patients from Canada, United States, from different parts of the world, and all of them came to here to Bios, and they are really nice with us, and they are pleased to share these pictures to you. So we are really happy to see the differences in them and how the quality of life, not just from the patient, for all the family, is getting better and gaining a lot in different ways.
And the most important is that what we want is that your patient has a better quality of life. That most of the times the spasticity is so bad that the patient is in pain, or it is very difficult for the caregiver to go to different places because of all of what is implies to transport the patient. So all of that is something that we are really proud of, that we improve these situations, and it can make you a better life, and to improve the quality of life of all of the patients.
Okay, so you will see some of the facilities that we have, that we try to be always in a private facilities, not in a public hospital. But we will have some questions that we already know that you might have. During this time, we will be really pleased if you make all the questions that you may have, and we will answer all of them. But you have to know that it's not just us, it's a full team with specialized and the laboratory people specialized to work with you, to take you from the hotel or from the airport to the hotel and the other way around. All the people is going to be really, really happy to help you. It's a full team of people trying to give you the best experience as possible.
Drivers, the reception girls. There is a big group behind us, and so you don't feel alone when we are here. Like we said, you can be in contact with us 24/7, and that everything is more personalized. If something came up, we try to solve it immediately.
So yes, we have some questions that the people sent us. The first question was, for how long we have to be here, or to be here in Mexico? I think
I think that it's around 6 to 7 days. We try, even the therapy, it's 3 days of stimulation, and the day number 4 is the therapy per se. We like that you can be here at least 24 hours later to see that there are no any kind of effects on the patient because of the therapy. These effects can be headache, nausea, throwing up. So we want to control them and to see that everything is okay. So that is why we ask you to be here at least 24 hours or 48 hours. And so you can be here around 6 to 7 days.
Some other questions people ask about if we have to do some requirements for the therapy. Well, the first thing we ask you is to give us your medical history, to know that you have a condition that we can treat or we can work with. And when we have that, everything goes really quickly, because we can help you with the hotel reservation, we can help you with the transportation, and to do all these things with you and help you to be here as soon as possible.
About this point, it is important, specifically for patients with cerebral palsy, that you can schedule an appointment with us. It can be a video call or it can be a phone call, because most of the patients with the cerebral palsy, they have an important background that we need to know. Since number one, to see that the patient is candidate for the therapy. So you can schedule an appointment with Dr. G or myself, and we talk about all of the background of the patients, about preemie babies, there is an hypoxic situation when they were born, an accident, or ischemic disorder or something. So it is very important that you that we have this conversation to see all of the situation of the patients, to be totally individualize the case, and to see that the patient is candidate, and if in case that it is correct, we can schedule the therapy per se. So it is important that you do that. We are very happy to talk with you, and we can have it both ways, or a video by Zoom or by WhatsApp or FaceTime, and to see that and besides that, you are more you can answer directly all of the questions about your patient.
Also, some people is asking what we use for stimulation. Well, what we use usually is is a medication that is already used for patients that are healthy and that they want to be donors for the bone marrow for other kind of illness. Yeah, for all kind of situations. So this medication that we use is the same medication for our patients. It's really secure and safety to use, and we already have been using this medication around more than 15 years, so everything is really secure in this way. I don't know if it's another questions over there.
Yes, we have how this therapy regenerates the damaged cells in the brain. That's the first one.
Yeah, well, it's several things. One of the things I think is the little proteins that is in the stem cells goes to the area that is damaged and starts to make a niche. And in this niche, it starts to make these changes and starts to be the area that is damaged. For example, if it's a neural area, there will be a neural in per se. So there's going to be a change in that area. It's going to replace it. But also, they have some cytosines and also some proteins that are released in that area that starts to decrease the inflammation and also to repair the area.
Yeah, and there is what is the regenerative medicine and reduce the oxidative stress also. So there are many ways that the regenerative medicine works.
Okay, the second one says, do the injected stem cells pass the brain-blood barrier?
Do the what?
Do the injected stem cells pass the brain-blood barrier?
Yes, what we do when we make this injection intrathecally, we cross this brain barrier to use the neural fluid that is inside there to transport the stem cells from the back of the patient to the head or the areas that it needs to go. So yes, we cross this barrier through this injection.
Yes. Is the sedation dangerous for the patients?
No, actually, that is what is important. The appointment that we have before, because we can have all of the if the patient has already been under anesthesia or something before, we have a specific doctor that is with your patient every minute, and we try to be a mild sedation. We don't that when we take off the mask, it's going to stop and the patient is going to be awake. And also all in BIOS and all of that we are involved in the procedure, we are certified for the American Heart Association. So we have, in case that something came up, we are able to do the right things in case that something came up.
Something important in this is the sedation is really quick because the procedure is really quick. Usually in the first part we take around 30 minutes, 45 minutes around, sometimes even less. And in the second procedure is 15 minutes. So it's really safe. In these several Gs we never have a problem. But yes, we always try to be the most prepared for any cases, that any success to have success in the patients.
Will the process be painful?
Actually, the patient is not going to feel anything, is going to be asleep, and we are going to give medications to keep any pain this moment. And afterwards, we are going to also give you some medications to give it through oral or to give it in different ways to prevent pain, headache, nausea, fever, all these symptoms that we could have afterwards. We will prevent it with medications.
How many rounds of stem cells do I need for my children?
No, that is up to you. We try to see the results after the first one. We made several appointments later to see all the improvements in the different areas that the patient have. And when you decide to do a second one or a third one, we are not going to tell you like in other places that you need 4 or you need something. It's up to you. But like Dr. Guillermo said earlier, that all of the improvements sustains, and then you can gain more in several therapies later. The only thing that we said is that you have to wait at least 6 months between therapies, so the body can totally heal, totally regenerate, and to do a second one or a third one 6 months from the previous.
Okay, what about the cost?
Okay, about the cost, we can talk about the real cost with the sales area. We are the medical area, so if you want to have more information about that, please just when you contact through DM, just tell that you saw the webinar so you can have a special price about it, because all the people who saw this will have it. So just tell them that you saw the webinar. Yeah. Okay, so I think this is it in the questions. Anything you might have in questions later or you will think about it, please contact us through DM, email, or the Instagram. I think in the last slide you will see some information that you can also contact us. But yes, we will be really pleased to see all your questions, and we will be glad to answer if we can do it. Yeah. So anything you can ask.
Okay, thank you so much for joining us today, and we are really pleased that you were here. And if you have any questions, like Dr. Guillermo said, we are very happy to help you to decide to do a stem cell therapy with us at Valle. Thank you so much.
Thank you.